Hey everyone, this is Amy Holland and I'm the sepsis coordinator for North Little Rock. I'm coming to you today just to do a quick educational video on sepsis. It's going to be like a re-education on sepsis care for the hospital. Since COVID has come to the forefront of everyone's mind, we've had a little bit of a downswing in our sepsis compliance. So with that, I thought that it would be a good thing to do some education for the hospital, and so we're just going to kind of go over the sepsis bundle or the sepsis order set real quick. So basically with sepsis, I just want to go over real quick what basically sepsis is. It is a life-threatening organ dysfunction basically caused from an infection. So you obviously have to have an infection. And then we go by SIRS criteria. So it's a systemic inflammatory response syndrome. And so we look at temp, if your temp's greater than or equal to 101 or less than 96.8, heart rate greater than 90, respiratory rate greater than 20. We obviously draw blood work on our patients, so if their white blood cell count's greater than 12,000 or less than 4,000. And then we do look at their differential, and if their bands are greater than 10%, that's important to know, which is their immature white blood cells. So that's kind of what we look at when we say SIRS criteria. So there has to be a concern or a known source of infection, and then SIRS criteria to have a diagnosis of sepsis. So that's basically sepsis. But then we look at sepsis with organ dysfunction, which is something that, can be very serious for a patient. And so when we say organ dysfunction, that means that one of our organs has been affected. So we look at patients' mentation, if it's been altered, if it's a new alteration in their mentation. We look at their respiratory status, if they have acute respiratory failure, and we look at their blood pressure, if their blood pressure is affected, if they have hypotension. We also look at their lactate levels. That we draw lots of lactate levels in our facility. And basically why we do that with the lactate levels is because this shows if they're having, poor tissue perfusion to their organs, poor oxygenation to their tissues. So that's why it's important to look at their lactate. And if their lactate is greater than 2, that gives us an idea that their organs are being affected. So there's some things that we look at when we say sepsis with organ dysfunction. So that's kind of sepsis in a nutshell when we're looking at sepsis in our patients. So when we look at that, we say, we think that our patient may be septic, so what do we do about it? Well, at our facility, we screen every single patient that comes through the emergency room. We also screen every single patient every shift on our inpatient side. You guys are familiar with this. You screen your patients with each assessment. You look at questions, if they meet sepsis, screening questions. If they meet the vital sign criteria, you get a BPA that pops up that says, hey, this patient may meet sepsis criteria, and you have to alert somebody to do something about it. So with that, you start the sepsis protocol. So I want to kind of go over what the sepsis protocol is and what we need to be doing as nursing staff to make sure that we're meeting our bundle and our compliance numbers. So what we do is we collect an initial lactate level. That has to be done initially, and then with our protocol, we do a 2-hour and then a 4-hour. Sometimes though, it may be that somebody that's taking care of the patient, whether it's a provider or whoever, forgets to order a repeat lactate. So as a nurse, if you see that a patient's being worked up for sepsis and they have a lactate level that's elevated, you need to make sure that you draw a repeat lactate. You as a nurse can put in an order for a repeat lactate. You don't have to have a provider's order to do that. And we need to make sure that the repeat lactate is drawn within 6 hours of the first one. That's per the guidelines. So an initial lactate, if it's elevated greater than 2, you need to make sure that you get another one repeated within 6 hours of the first one, and you do not have to get an order from a provider to get that drawn. So I need for you to help me out with this, okay? Then we need to get blood cultures on the patient. Make sure that you get these blood cultures done. Make sure that you get these blood cultures done before the antibiotics are administered. And that's really, really important, especially if they come in through the emergency room or if they're a direct admit from a provider's office. You want to make sure that you don't start any antibiotics before you get the blood cultures. So make sure that you're a patient advocate, and if you're going to hang antibiotics and there's no blood cultures ordered, that you call a provider, you call me, you do something to make sure that these blood cultures get ordered. So make sure you do that. And then with broad spectrum antibiotics, with our sepsis patients, a lot of times we're going to hang multiple antibiotics on these patients. The one thing that I want you to remember on this side is to always remember to hang the smallest volume antibiotic first. We hang a lot of cefepime, a lot of rocephin, a lot of zosyn. Make sure that you hang those antibiotics first. And then if you have vancomycin to hang with these antibiotics, make sure that the vancomycin is hung last. The reason being is because vancomycin is not considered to be a broad spectrum antibiotic. It only covers staph and strep, and it's considered to be more of a gram-positive coverage antibiotic. The other antibiotics that I mentioned are considered to be more of a gram-positive and a gram-negative coverage antibiotic. So just remember, smallest volume antibiotic first. Those are the ones that go in over approximately 30 minutes, and then hang the vancomycin after that. The vancomycin usually takes a few hours to hang. If you have any issues with the vancomycin, if it's not ordered on the MAR right, the vancomycin is ordered first, whatever, you can contact me, you can contact pharmacy, you can contact somebody to make sure that this gets fixed, because we don't ever want to hang vancomycin first on a sepsis patient. And then if the patient is hypotensive or their lactate is greater than or equal to 4, per the guidelines, we have to give them a sepsis fluid bolus. I know that you guys are very familiar with this. It is weight-based. We have to give them 30 cc's per kilogram, and that's why it's important to make sure that your patient's height and weight is put into EPIC. If the height and weight is put into EPIC, it's already pre-calculated to give them the sepsis fluid bolus based on their weight. So all you really have to do is look on the MAR, see how many bags of fluid they have to have. You pull out the bag from the Pyxis and you hang it on your patient. So just make sure that the patient's height and weight is put into EPIC. If their BMI is greater than 30, we can use their ideal body weight. That's already pre-calculated as well. You don't even have to try to figure that out. It's already in the background done for us. So just make sure their height and weight is entered. And we do lactated ringers on these patients. So if the provider wants to do normal saline, they'll have to change the order by hand to make sure, they have to type in normal saline to hang that normal saline instead of lactated ringers. So with that, we talked about the importance of doing a repeat lactate within 6 hours if the initial lactate is greater than 2. We've talked about the smallest antibiotic and volume antibiotic being hung first, always making sure that vancomycin is hung second, and making sure that the blood cultures are obtained before you hang the antibiotics. And we also need to make sure that when you get these antibiotics, that you hang the antibiotics within 3 hours. We have to make sure. And honestly, I really want you guys to strive right now to get these antibiotics hung within the first hour that they're ordered. That's what I want you guys to strive for. That would be a really good thing for our facility to be able to say that we hang our antibiotics within the first hour. And then making sure that overnight, if you can make sure that there's nurse practitioners at night here pretty much all the time. If you guys need any assistance, they are very well versed in what needs to happen with sepsis patients, so call them if you have any issues. And then for the unit patients, all of my unit staff nurses, if a patient comes into the unit that is being worked up for sepsis, if you could please notify the nurse practitioners to let them know that they are in the unit. They want to make sure that everything's been done on these patients. A lot of times these patients need a reassessment documented on them. If they are getting a fluid bolus or if they're started on vasopressors, they have to have a reassessment documented in their chart. So the nurse practitioners have been very willing to help in this area. So please call the nurse practitioners if the patients come to the unit that are septic overnight. And then also, if a patient gets a fluid bolus and their blood pressure does not respond, you need to make sure that you remember this too. You can't just sit around and watch their blood pressure and hope that their blood pressure gets better. If their blood pressure does not respond within the first hour after a fluid bolus, you have to call to get an order to start them on a vasopressor. We have to make sure that we're doing this. We can't just wait around and see if their blood pressure is going to respond. The guidelines say if their blood pressure does not respond within the first hour after a fluid bolus, you have to call to put them on a vasopressor, okay? So just make sure that you're watching their blood pressure and doing something about their blood pressure if they don't respond to their fluid boluses. And then one last thing, in the last month, we put on the order set a reminder to make sure that you guys are using the suspected sepsis on shift flow sheet. That's the flow sheet that we put in Epic to make sure that you're doing what you need to do when you're working your patients up for sepsis in the emergency room. They're going to be utilizing that so that it's a good reminder for when the patient goes from the ED to the unit, and then even to the floor, so that we can see what the patient has been given and what the patient needs to be given as far as being worked up for sepsis. So make sure that you are doing what the orders say. It's on the order set now. It says initiate the suspected sepsis on shift flow sheet. So now it's basically an order that needs to be done. So make sure that you're using that flow sheet. We hope that it's helping with communication, and we hope that it's helping with our compliance moving forward. And then with that, if you ever have any issues, please call me. I will be there to help in any way I can. And I have created some sepsis questions from this video. So if you can answer these questions and send them in to me, then I will be giving you guys a treat. So I hope that you found this video helpful, and I hope you guys have a good rest of your day.